Hello, everyone. Thank you for joining us. Welcome to Work, Women, and Caregiving, discussing the role of employers in supporting carers at work. My name is Karen Dietrich, and I am the Director of Operations and Engagement at the Canadian Hospice Palliative Care Association, and I have the pleasure of moderating today's discussion. So I would like to acknowledge that the Canadian Hospice Palliative Care Association is located on unceded territory of the Algonquin Anishinaabe people who have lived on this territory for millennia. Their culture and presence have nurtured and continue to nurture this land, and we are grateful for the opportunity to be present in this territory. The Canadian Hospice Palliative Care Association, or CHPCA, is the national voice for hospice palliative care in Canada. We strive to ensure that all Canadians have access to quality hospice palliative care, and we do so through public policy, education, knowledge translation, awareness, and collaboration. Palliative care is a specialized form of healthcare for individuals and families who are living with a life-limiting illness that is usually at an advanced stage. The goal of palliative care is to provide comfort and dignity for the person living with the illness, as well as the best quality of life for both this person and their family. As such, understanding the needs and challenges of caregivers and ways to support them is critical to CHPCA achieving its mission. We're proud to be hosting this event leading up to International Women's Day, taking place tomorrow, March 8th. This is a global day celebrating the social, economic, cultural, and political achievements of women. Today's discussion will bring academic and corporate perspectives together to discuss the benefits for employers who provide support for working caregivers, best practices and common hurdles to implementing supportive policies, the latest research findings on some of these issues, and the impacts of caregiving on working women's lives. We will begin by hearing from Dr. Allison Williams about working caregiver definitions, research, and data on working caregivers and the development of carer-friendly workplace standards. So a little bit about Dr. Williams. She is a social and health geographer and professor at McMaster University, whose research focuses on workplace practices for supporting employees with adult care responsibilities. She currently holds a McMaster University Faculty of Science Research Chair and leads a partnership grant made up of more than 50 collaborators, which mobilizes carer-friendly workplaces. We will then turn it over to Cathy McCallion about Ross Video's commitment to supporting caregivers at work, the Canadian Compassionate Company certification, and why this issue matters to Ross as an organization. Cathy is the Stakeholder and Community Relations Director at Ross Video. Ross Video is the corporate ambassador for the Canadian Compassionate Companies, or CCC, certification of the Canadian Hospice Palliative Care Association. As a CCC, Ross Video demonstrates their commitment to compassion through their policies and practices that support their employees who also provide unpaid care for a loved one. Following these brief presentations and overviews, we will engage in a panel discussion, closing with time for audience Q&A. That being said, please feel free to put your questions in the Q&A area at any time, and we'll bring those forward as we go or when we have time and it's appropriate. This session is being recorded, and a link will be provided to all who registered, as well as made available on the CHPCA website. And so with that, I will turn it over to Dr. Williams.
Wonderful. Thank you very much, Karine. And thanks very much to the Canadian Hospice Palliative Care Association for investing the time and energy in making this happen today. So I'd just like to first begin by recognizing McMaster University, as well as the Social Science and Humanities Research Council, the Canadian Institutes for Health Research, and my research lab looking at care-friendly workplaces. Next slide. I'm going to be talking today about care workers, who are really, for the most part, defined as people who are not only providing unpaid care work, specifically to adults living with a physical or mental disability, long-term health condition, or problems related to aging, but also simultaneously engaged in the labor market. Care employees, or care workers, as they're sometimes called, can be caring for a parent-in-law, a spouse, a life partner, an adult child, a friend, or maybe even a neighbor. And what we know from the larger literature is that many care workers do not self-identify. And as a geographer, my interest is really looking at the tensions that exist between multiple places and roles that these care workers live on a day-to-day basis. Those being the places between work and employment, unpaid care work, as well as home, which is again inclusive of domestic management and often caring for young dependents as well as other family members. Next. So in Canada, we have a pretty wide distribution of care workers. Of our 8.1 million unpaid carers across the country, 75% of those are care workers, also called care employees. So they make up a significant number of carers and carers, unpaid carers rather, within the Canadian population. 43% of care workers are providing care to parents and in-laws, whereas 16% are providing care to spouses or partners, and 14% are providing unpaid care to neighbors. Next. Unfortunately, due to the multiple burden of both care work and paid employment, there are a number of different outcomes which are unfortunately are quite negative with respect to managing these multiple responsibilities. We know that 1 in 4 caregivers are sandwiched between child rearing and caregiving, in addition to their paid work responsibilities. And 50% of these care workers are between the ages of 45 and 65, representing the most experienced sector of the labor market. Next slide. We also know that without supporting care employees at work, there's a number of different costs to employers, including increase in disability costs, increase in employee turnover, a less productive workforce, the loss of skilled employees, a decrease in employee retention, and an increase in absenteeism. On the contrary, there are a number of benefits for providing accommodation and supports for care workers, including a competitive advantage, the retainment of skilled staff, improved productivity, reduced absenteeism, reducing the number of employees coming to work sick, as well as a more engaged workforce. Next slide. So I mentioned some of the negative outcomes in my last slide, but here are some very specific statistics that speak to how care workers experience negative outcomes, from 20% experiencing physical and emotional health challenges through to 10% turning down job opportunities. One of the more problematic statistics is the 6% who leave the workforce altogether, because they're not only leaving behind a salary and often contributions to pension, but they're also leaving behind a sense of meaning and a sense of significance in their lives. They're often leaving behind their social network, an opportunity for ongoing engagement and personal improvement, and so on and so forth. And that's exactly what employers need to be cognizant of in recognizing the importance of supporting these care workers. Next slide. So McMaster University partnered with the Canadian Standards Association group back in 2015 to build a voluntary standard called the Care Inclusive and Accommodating Organization Standard. And what this standard and associated handbook does is it provides basically a set of guidelines for employers to create care-friendly workplaces from the bottom up. Fortunately, these two documents are currently complementary and are available for download on the Canadian Standards Association group's website. Next slide. Very quickly, the key elements of the standard are to first set the stage through defining the scope and determining the guiding principles. Next is developing the program as it relates to the sector as well as the size of the employer, in addition to the gender ratio of the employees that exist within the workplace. Then the implementation of the program recognizes awareness, training, communication, and best practices, after which we monitor and measure the implementation of the program with respect to uptake and satisfaction. And this feeds into reviewing and improving the program for the next iteration. Next slide. I wanted to point out that we have a wide range of tools on our website, one of which is this quick study guide, which really distills the standard into 2 pages and specifically notes the importance of, again, human resource professionals and managers in creating the opportunity for care workers to not only self-identify, but to engage in the building and implementation of the standard. Next slide. The idea of a care-friendly workplace is of critical importance, given that in Canada, as elsewhere throughout the world, we are moving towards an increasingly aging population. For example, by 2030, 23%, close to 1/4 of our population in Canada will be over the age of 65. So we need to be looking for opportunities to support these care workers, given that 70 to 80% of all care work in Canada is provided by these unpaid carers, the majority of which are women, due to the socialization that women receive in their developmental years, as well as the expectation, not only culturally, but from society more broadly, to provide unpaid care. Next slide. Very briefly, I wanted to point out that out of our 30 projects that have been taking place over the last 15 years, again, all noted on our website, we have 2 very detailed case studies which speak to the implementation and uptake of the standard. The first is one that we partnered with a post-secondary educational institution with, and the second where we partnered with a multinational oil and gas engineering contractor. And what these case studies suggest is that first, the implementation significantly reduced, that is statistically significantly reduced, depression, psychosocial health, and self-reported health outcomes. It also improved job security, schedule control, work-family conflict, family-work conflict, as well as supervisor and coworker supports. It also built satisfaction with supervisors, job satisfaction, as well as enhanced work culture, and provided solidification of caregiver identity, which we know is a huge problem. Many care workers don't self-identify at work for fear of stigma. So the implementation of a care-friendly workplace allows that to actually happen. Our first case study with a post-secondary educational institution showed that it was cost-effective, with a positive net benefit estimated between $48,000 and $676,000. Next slide. We've also completed 2 international scoping reviews, one in 2016 and the other in 2022, which recognizes a number of facilitators, including a motivated workplace, specifically one that's focused on EDI, equity, diversity, and inclusion, that recognizes care workers within the EDI framework, a focus on work-life balance, having champions, ideally at the senior level, who are able to guide and champion care-friendly workplaces, as well as personnel and resources available to get the program off the ground, and the recognition of the need for persistent and lengthy commitment. The primary barrier for the implementation of care-friendly workplaces is primarily, again, culture. The workplace culture has to be accepting of a care worker self-identifying at work and being cognizant of the fact that care workers are, again, required for inclusion, diversity, and equity programs. There has to be a focus on, again, work-life balance, and then the prioritization of care-friendly workplaces over other issues, such as the upheaval that COVID had imparted on many workplaces. And then finally, not dedicating the personnel and resources to making such a program happen on the ground. Next slide. I'm just very briefly going to go over some recently published data that looked at care workers in Canada and across a number of different countries internationally. And Canada is represented in this line graph in red. And what we can see is that at the COVID peak through to the fall of 2020, the mean hours spent caring per week were approximately 19 and a half. And again, compared to other countries, we were doing quite well. Next slide. In contrast, we weren't doing so well with respect to employee support. These three line graphs show the percent of care employees receiving support before and during COVID. And the first line graph on the left shows federal government support, with Canada being in third place. Local state government support is the second graph, again showing Canada in third place. And the third graph shows employer support. And unfortunately, this is where Canada did very poorly. Before COVID, third last, and during COVID, absolute last, which suggests we certainly have our work cut out for us with respect to employers playing a role in supporting care workers at the workplace and consequently in their lives more generally. Next slide. Here we have a graph that shows the deteriorating emotional and mental health of care employees versus the level of employer support, with Canada noted in red. And what we can see here is that more than 70% of all care workers were experiencing deteriorating emotional and mental health, with only 20% of them receiving support from their employer during COVID-19. And this is highly problematic, particularly when compared to all the other countries that are noted in this particular study that represent both the G7 as well as Australia. Next slide. So keeping with this global advocacy for care employees, McMaster University partnered with the International Standards Organization and unveiled this international standard in 2022. And this has received some uptake across the globe, primarily in countries represented in Western Europe. And what we're trying to do here is really focus on recognizing that unpaid care work is not only an issue in the global north, but also one in the global south. Next slide. Just very briefly, this is our working group membership. Again, of the voting members shown in blue, we can see that the majority are representative of the global north, although we do have Uganda, South Korea, Singapore represented in our voting membership, which suggests that, again, there is interest in a more equitable society globally. Next slide. This international standard really focuses on addressing a number of the United Nations Sustainability Development Goals, and we've recognized 5 here, although in other research that we've done, there is a total of 8 SDGs that are highlighted. But very briefly, the standard recognizes gender inequality and works to reduce these inequalities. It also focuses on decent work and economic growth, as well as good health and well-being, not only for women, but for their families, as women are primarily responsible for young children. Also, the issue of poverty, addressing poverty, and sustainable cities and communities, as it takes a village to take care of an elderly person or an adult person with a disability. And then finally, I'd just like to mention in our next slide, our next steps. So my research group continues to build the business case for the importance of care-friendly workplaces. We're also doing research to unpack caring as a human right, both again in Canada and globally, and we continue to track the UN SDGs with respect to the impact of our international work. Within the practice community, we continue to advocate for the importance of supporting care workers within EDI and mental health initiatives, as well as educating human resource professionals, managers, supervisors, and executives about the importance of championing this issue. And then finally, we continue to empower care workers to advocate for themselves and for their colleagues to reduce the stigma at work. Next slide. Please visit us at our website, Care Friendly Workplaces. And finally, do pay attention to the tools and curriculum tab, which on the final slide shows a few of the free downloads that are available on that tools and curriculum slide. And again, they're for free download and available and accessible to anyone who chooses to visit the site. So thank you so much for your attention, and I look forward to our panel discussion. Back to you, Karine.
Perfect. Thank you so much. Great overview. A lot of work over a very long amount of time. And I think a really great way to set the stage for this discussion. So thank you so much for sharing that. I've noticed there are a few Q&As in chat, so I'll keep an eye on that, but I'm just going to bring forward Cathy's perspective on kind of what she's heard, and from Ross Video's perspective, what does a compassionate, carer-friendly workplace mean, and why has this become a priority?
Well, thank you very much for having me here today. It is a very important topic, and I'm thrilled to be here. In the spring of 2021, Ross was introduced to the CHPCA, because we were recognized as meeting the standards for leave programs at that time. So this was the start of our relationship with CHPCA. As the months went on beyond that, as that relationship was developing, we at Ross had an ED&I task force, an employee task force that often discussed ways of improving the lives of our female employees. And we looked at ways of improving their lives and providing support. And one of the top issues that were brought forward were leave and caregiving. And so from that point, our senior management team and HR teams worked together to enhance our leave programs. And so the leave programs do cover maternity, paternity, and adoption leave, sick and short-term disability, but specifically here with regards to CHPCA and our relationship, we enhanced our family medical leave and our compassionate care leave. So it was really to support those caregivers who are caring for loved ones during very challenging times, often at end of life. And so from there, we put those leave programs into place, and we were thrilled to be, the following spring 2022, we were thrilled to be certified as a CCC, a Canadian Compassionate Company, and honored to be the ambassador to, the industry ambassadors to CHPCA. So why is it important to Ross? Well, really, honestly, this is about providing support during challenging times. We know that these programs not only demonstrates to our employees, but specifically our female employees that will support them during these difficult times. It also ensures that their roles are protected, that it eliminates that financial stress that individuals go through during these challenging times. And the aim is to provide support, ensure that the caregiver remains at Ross. Really, ultimately, it's about making sure that caregivers don't leave the workforce. And so many of those caregivers are women. And we have seen specifically during the pandemic, just a huge number of individuals leave the workforce, and a lot of talent is lost. So this was our goal, to show support and also ultimately keep them in working throughout their careers.
Perfect. Thank you so much, Cathy. Allison, you mentioned the Canadian standards and the international standards in your presentation. How have you seen the implementation and impact of these standards play out in Canada and across the globe? I know you mentioned those two case studies, but you've been immersed in this work for a long time. So is there anything else in terms of the implementation of these that you can speak to?
Sure. Yeah, certainly. We know from the Canadian Standards Association partnership that there has been close to 1,000 downloads of the standard and handbook. We are embarking on a research project that's connecting with those folks to determine the extent to which they've actually implemented carer-friendly workplaces. We're also doing a analytical study on our various tools under our tools and curriculum page to determine the number of downloads. So that gives us an indication of the degree to which folks are actually engaging in, first of all, educating themselves and making themselves ready for implementation. So I'll know a whole lot more about that in about 12 months' time. Internationally, we know that there are a growing number of countries who are becoming aware of the international standard. Weekly, I usually get between 2 to 3 emails from international folks who are interested in learning more about implementation. So again, it's a very slow process, and we are working to market and advertise the availability of the international standard. The issue is that there is a cost associated with the international standard, unlike our Canadian standard. So if the country of interest is concerned about paying for it, I usually direct them to the Canadian Standards website, as it provides, again, a template for that international standard. So our Canadian standard was actually the framework for the international standard. There are clearly some differences that exist between the Canadian and international standard, but at their core, they're very much the same document. So internationally, again, for those interested in exploring the standard, I suggest the complimentary download at the Canadian Standards Association website.
Perfect. Thank you so much. And just as just so we don't get too far away from the data and the research you presented, there was a question that came in about how much of the data or uptake is involving the healthcare environment. Are you able to discern part of that?
Again, that's something that we'll be exploring in the next 12 months with respect to the CSA partnering with us on that evaluation study. But what we do know is that as a result of our partners being in the healthcare sector, not only partners such as the Canadian Hospice Palliative Care Association, but the Canadian Home Care Association, as well as Carers Canada, Pallium, St. Elizabeth Healthcare, Canadian Cancer Society, and the list goes on. I'm assuming that a good majority of uptake has happened in the healthcare sector. And that's primarily because the healthcare sector is populated by female workers. And we know that between the ages of 45 to 65, women are, again, primarily doing this type of care work, managing both paid employment and unpaid care work. So we call these folks in the healthcare sector double duty carers, because they're not only providing healthcare in their paid work, but they're coming home and providing unpaid healthcare supports, and consequently are more likely to burn out. So those negative health outcomes that I was referring to earlier are happening more predominantly within the healthcare sector as a result of that double duty scenario.
Great, thank you very much. Cathy, I want to turn it back to you. So since Ross Video has implemented these different kind of, you mentioned compassionate leave and different policies around leave, what has been the impact on the company culture? So one of the barriers that Allison talked about was really that culture. So can you just speak to any of what you've seen in that realm?
So what I see, and this is obviously from a personal stance as well as from an HR perspective, is a culture of safety, right? Our employees feel safe to come forward and let their colleagues know, let our HR team know that they are in a caregiving situation, right? That they are supporting family members through a difficult time. And so that's just so important. It's important for the individual, and it's important for those who are, and the team members of that individual, right? They see that the company is supporting that person. And it also, from a culture perspective, it really shows our colleagues that we're willing to step up for each other, because there are gaps, right? When a caregiver goes away and is on leave, then there is a gap. And what we do find is that people are really ready to step forward and fill those gaps and help each other out, because they also know that at any point they could be in the same situation. So it's really quite wonderful. It's an extremely supportive environment, and we hear that over and over again. We have an employee experience monitor that we distribute to our employees on a regular basis. It tracks basically how people are feeling about the organization, and it constantly cites the lead programs. People are able to leave comments and just saying how well supported they feel at Ross. It really has made a huge difference. And this is, our Canadian employees, but also our employees around the world as well. I also wanted to make note, for anyone who is a naysayer in the sense of, from an industry perspective, I think that the employees that are treated well, in turn, are more productive, and the customer service that they provide is top notch. And we see it over and over again. And these are external surveys that are given. So this has nothing to do with Ross internally. These are our customers saying, wow, these are well supported. Your people are well supported, and we can tell in the service that we receive. So it all comes back to play, and it does, in a sense, hit the bottom line as well.
And just to expand on that a little bit, because Allison mentioned kind of the Canadian and international, and you just mentioned there, you are an international company. So how does maybe different cultures, I'm taking a bit of a different angle on culture, how have you seen that impact or play out in terms of the movements you've been making here in Canada?
So from a cultural perspective from around the world, is that where you're the idea? So I mean, obviously it's extremely important, right? Women, depending on the country, I'm not going to deny that women are not as well supported in certain regions, and so this has had a huge impact on those individuals. It helps us attract more women to the industry. We all know that in STEM it's difficult to that our numbers are not there with regards to female workers and employees, and these acts of support really drive our recruitment efforts with regards to female employees and those who identify as female.
Thank you. Dr. Williams, so based on your experience and research, what have been some of the challenges in implementing or creating compassionate companies or workplaces? So you mentioned your work included reaching out to employers, providing different tools and different resources, in trying to get uptake in this area, getting people to take this perspective in their workplace. What have been some of the barriers and some of the facilitators to trying to make that happen?
Yeah, sure. The facilitators and the barriers have really been recognized in the scoping reviews that I referred to earlier. And just to recap, the primary barriers have been a workplace culture that, as was mentioned, isn't safe and doesn't allow for individuals to identify as care workers, and consequently, these individuals don't feel comfortable enough coming forward and requesting what they need with respect to accommodations and supports. Another big barrier is the recognition that care workers are not part of EDI initiatives. And I would argue that they're actually quite central to EDI initiatives. So we not only have the majority of care workers being women, but the majority are in their more senior years, and the majority are in a highly vulnerable place with respect to burnout, not only mental burnout, which is usually what happens first, but often physical burnout. And I referred to disability insurance issues as a concern for employers. And certainly, if again, EDI initiatives were encompassing and inclusive of care workers, we would see so much more support happening on the ground. That's really, I think, an opportunity that we currently have in today's labor market, given that EDI is front and center in many workplaces. Encouraging the inclusion of care workers is really central. And facilitators really speak to what was said earlier about safety, being able to have a champion, ideally at the executive level, to really recognize carers. And oftentimes through our research, we've found that those champions have been care workers themselves, and they recognize the multiple demands on their time and their energy in doing their very best at work, as well as their very best in providing the unpaid care work that's needed at home or in the community. So oftentimes these are the champions that are saying, yes, we're going to make this change. Like Ross Video has done an extremely amazing job at making the change and making it work, not only for the employees themselves, but for the employer more broadly, because obviously there's been some really amazing indirect consequences for the employer that have taken place.
Thanks, Allison. I saw Cathy nodding, and so I'm kind of wondering, there's what the research says, and then there's what you've lived and experienced. From your employer's perspective, taking it from that diversity, equity, and inclusion lens, I saw a lot of head nodding there. So I guess any tips you have on creating that safety, right? We want to create a safe space, but how do we do it? How do we get buy-in? So any insights on your experience through this journey so far? Because it is a journey.
Yeah. So, I mean, it's almost like I wanted to repeat everything that Allison has just said. We have an extremely supportive senior management team, and it really starts there. If you don't have that, it's something that really needs to be, in Allison's words, championed by those senior leaders. And in Ross's case, we have a phenomenal group of people at the leadership table. And that drove the policies, that drove the support, and from there, really that feeling of safety that is exuded. We have quarterly staff updates every few months, as the title suggests, and that's a really open. There's a lot of open dialogue. It is a confidential meeting for all of our employees, but the openness of that communication is quite incredible, and I think that facilitates that level of safety for everyone. We talk about issues like the LEAP programs, like caregiving, and that provides that again, that level of safety to our employees to be able to come forward and share with their colleagues, share with their HR business partners, and get the support that they need during those challenging times.
Perfect. Thank you very much. There is a question that came in the Q&A for you, Cathy, and asking a little bit more about the details. So what are the formal requirements, for example, for care employees at Ross Video in terms of proof of caregiving? So what are you asking your employees? What's required? So similar to providing a doctor's note for certain leaves of absence, is this mirrored with the care employee accommodation?
It's mirrored. It's not a difficult process by any means, but there is often a doctor involved. There is often some type of written documentation, and we try to make it as simple as possible for our employees to follow through.
Perfect. Thank you very much. So I'll pose this to both of you, and whoever wants to jump in first can. So we're having this webinar specifically leading up to International Women's Day, and you've mentioned it both in your comments a little bit, framing this topic from a gendered lens. Why do you think it's important for us to discuss the topic of caregiving and the workplace from this gendered lens.
Do you want to go first, Cathy, or would you like me to try?
You can go first, Allison.
Okay. All right. Thank you. Yeah. Well, as I mentioned in the presentation, care work is women's work globally. And I'm happy to share that that's changing in Canada and in many countries. We look to the Scandinavian countries as our sort of, gold standard with respect to recognizing a more equitable society as far as not only care work but domestic management more broadly. But the vast majority of care work is primarily done by women, and as a consequence, this prevents them from not only receiving higher education, but it prevents them from entering the labor market and being promoted within the labor market. So it really is, unfortunately, a barrier to women's advancement and self-actualization to be the best they can be while also contributing the most to societal well-being and the good of, again, developing and sustaining and improving our world. So that's why it's important. We need to have a more equitable division of labor when it comes to care work and domestic management more broadly in order to realize the great treasure trove of what women can bring to the world, not only in the educational sector, but in the workplace and in the globe more broadly. And we have been seeing some really fabulous leadership in many international organizations such as the WHO and the United Nations. And we need to see this happening more and more in order for countries to recognize that women actually do have a role to play, not only in leadership positions, but in the world of work. And this will hopefully percolate down to providing and creating policies and programs for more equitable division with respect to care work and domestic management more broadly.
Absolutely. Cathy, anything that you wanted to add?
I
She covers it well, doesn't she?
Yes, Allison, you are an incredible speaker, and I have to say, you capture all my thoughts. I just keep on nodding my head over and over again. But this is exactly why Ross did what they did, right? I mean, this was driven from an ED&I perspective. This was the focus group at Ross that really was looking at those initiatives and what we could do specifically for our female staff and how we could support them. And this is what came out, and this was the top of their list, right? We struggle. We struggle every day to attract women to technology and to technical fields, and specifically broadcast technology. It's even tougher. So we need to do everything we can to show that they will be supported, and when they are going through these difficult times, their employer will be there to see them through.
Yeah, absolutely. And in one of our Q&As, we have more of a comment, but I think it definitely is a good point, and I'd love your perspective on it, that companies should consider loss of revenue due to short-term and long-term disability claims, the cost of new hires. Companies also need to rethink backup plans, so more than one employee is accountable for given tasks rather than increasing kind of the popular model, which exposes them to risk if employee caregiving cannot be performed. So there absolutely is these kind of employee retention, cost benefit, and that, like, there's a lot of different elements to this in terms of just good management practices and risk management and all of those things. So any thoughts or insight on that comment that's come forward?
Yeah, sure. I can just briefly note that the job sharing idea is one I think that is beneficial across a number of fronts for care workers, as well as employers more broadly. But flexible work is certainly one accommodation that is recognized as really beneficial and has been proven to be beneficial during the pandemic. We also have culture change initiatives and educational workshops. So carer-friendly workplaces can be as simple as educating care employees about how to best manage, whether it be time management strategies, whether it be, care work at home versus care work and long-term care. Again, the work-life balance strategies that exist out there. So again, it can be small changes, such as brown bag lunches around best ways to move forward. And it can also be making employees aware of what's currently available. So what I had found in the work we did with the educational institution, the first case study I spoke to, is that the majority of care workers were not cognizant of what was available to them in their EAP, their employment assistant program. So really just making those benefits brought to their awareness was a critical piece. But I think, as Cathy mentioned, accepting diversity in the workforce, including, again, a wide range of differences in family needs, is really a really excellent starting point for employers in thinking about carer-friendly workplaces. We have some of our gold standard employers in the pharmaceutical sector, in the financial and banking sector. And these employers who are providing really excellent care accommodations are providing paid leaves and non-contiguous leaves and a wide range of very generous leave programs. We don't really expect employers to go to that extent because, large pharma and again, the financial and banking industry, they not only have deep pockets, but they're very aggressive about recruiting the best. So recruitment and retention is a really critical issue. For small, medium-sized employers, they can start with small change that really bring about that culture change piece, that decrease the stigma with respect to care workers identifying as care workers at work. And they can, as I mentioned, be as small as educational opportunities, such as brown bag lunches. But that then could then build towards, for example, flex work or shared work or work from home and unpaid leave and so on and so forth.
Well, and I think that brings up a good point, this idea that you don't have to start massive, right? That you can start small, because we may have people who are joining us who are in smaller organizations or who are trying to create change within their particular branch of a larger organization or whatever that might be. So that was kind of going to be one of my other questions, is for those that might either be trying to advocate within a smaller organization to their employer or who are in that. I think you've mentioned a few great examples of, sometimes it's providing information, sometimes it's increasing awareness about what is currently and already available. I mean, how many of us start a new job, we've got orientation, we read policies and procedures, and we don't remember what they are anymore by the time we need them, right? So how do we keep some of those front and center that are really core to the types of employers that, different organizations and companies are trying to be?
That is one of the key things that we do at Ross. Is it is part of orientation, it is part of their job offer up front, is going over the leave program and explaining it to our new employees, and then they get an outline of a written outline, and then we have constant communications, right? Constant communications from HR, reminding them about our policies, letting them know, right? And then obviously within a team, right? It's encouraged when a colleague is on leave, those individuals are stepping up to fill the gaps, and there is open communication there, there's open dialogue about the situation, right? And how we best support each other.
Yeah, and Cathy makes a really great point about, coworker support, because again, those were one of the significant positive changes we saw in our implementation case studies. Is, coworker support is so important because, when someone does have to take a leave or, an extended period of time away due to, for example, some sort of diagnosis or treatment, then then the others can step in and play a role. And that support network is so critically important in in any workplace, and is really dependent upon recognizing that we're all going to be carers at some point in our lives. If we haven't already been a carer, it's likely just on the horizon. So, you know, we're all going to be doing this at some stage, and we probably will all be doing it multiple times throughout our employment career, right? So yeah, recognizing that coworker support. I also wanted to really accentuate the importance of supervisory and management support. So our intervention case studies really accentuated the training for HR folks, supervisors, and managers, because they're basically the individuals who are setting the culture, who are setting the tone for the workplace. And if they're inclusive and accommodating of care workers, then care workers, as Cathy mentioned, will be more safe to identify and come forward with their needs. I also just wanted to briefly mention the importance of caregiver support groups at work. So in our second case study with the oil and gas contractor, the care workers created a care support network, which was a virtual network that allowed them to share ideas, to support one another, to step in when needed, to overview best strategies for approaching HR, for approaching supervisors and managers in navigating their multiple demands. And that sort of initiative, again, is a very small start to a larger care-friendly workplace. If individual care workers can feel supported at work, even if it's by their coworkers, excellent way to get things moving around care workers, A, feeling empowered, B, recognizing that they are in fact part of EDI initiatives, and C, actually advocating for themselves to make workplaces more accommodating for their needs.
Allison, I wanted to add to that, at Ross, we have a mental health first aid course that it was originally given to all of our management team and HR business partners and recruitment. But beyond that, now it's offered to all of our staff. It's to help identify when someone is going through a difficult time and maybe they haven't come forward yet, but it then can be encouraged to talk about what they're dealing with. So that's another thing that's offered out there. There's some great resources, and I do encourage employers where they can to offer that course. We found it very, very beneficial.
Is that the one offered by the Mental Health Commission of Canada?
It is certified, so yes.
Yeah. There was another suggestion too about companies offering healthcare navigation consultants. So as the health system is shifting and there's more care home rather than institutions, more care employees are spending more time trying to navigate where they're providing that care. So clearly a comment you all agree with. And I know Allison, one of the resources that we've talked about is Caregiver Essentials, right? It's a free online course. And part of that is navigating complex systems. And my goodness, our healthcare system, our home care system, all of these things are extremely complex. So whether it's providing that support internally, these are the types of resources, these are the types of information that sometimes you just don't know, right? And it's so overwhelming and you're balancing so many competing demands that if a colleague or an employer is providing you with this type of information, saying, let me take the time to gather this information for you, let me give you some time to consider all of these different things. Again, a small step that can go a really long way. So one question, and I know we have about 5 minutes left, so if anybody else has any other questions they want to raise or comments, please feel free. You can use the Q&A box. I believe you can also put them in the chat. We will bring them forward. But quick question for either of you. Do you happen to know what are any of the legal ramifications for companies who let people know, sorry, something just shifted. What are the legal ramifications for companies who let people go, deny promotions or proper compensation to those who are experiencing large caregiver burdens?
Well, I can just speak very briefly to one study that we're currently conducting in my research group, looking at caregiving as a human right. So oftentimes individuals who are denied supports at work can go to the Human Rights Tribunal to basically make their case for supports at work in order for them to continue to provide care. Because many employers are not cognizant of the fact that caregiving is in fact a human right in Canada and in many other parts of the world. Caring for family members is a human right. So if an employer is not comfortable sitting down and having that difficult conversation, and it doesn't always need to be difficult, but for many employers and many care workers, it can unfortunately be a difficult conversation, then the individual employee, if not managed appropriately, can in fact make a complaint to the Human Rights Tribunal if they're dismissed or not properly accommodated. Again, we have a wide range of resources examining this on our website under Tools and Curriculum. And this particular issue is addressed in our managers training slideshow. So that would be the tool to explore. But certainly, if you wanted to chat with me more about that, I'm more than willing to connect. And I believe our emails are being shared. So certainly don't hesitate to reach out.
Wonderful. Thank you very much. So we have just a couple of minutes left. So any kind of closing thoughts or remarks before we sign off? I'm just going to put up a slide that has a little bit of links. Also want to clarify, we talked about the standards that you've developed, Allison, and we've talked about the Canadian Compassionate Company certification. So these are complementary. So really that CCC that Cathy was talking about is really focused on compassionate care leave. It talks about support for advanced care planning. So these are all things around illness trajectory that people will be facing and can be really supportive in that workplace. So it's a little more specific to that type of support versus Dr. Williams is, I think, a more broader, robust. So we do absolutely see them as complementary, which is why we're doing this together. But I think there's a lot of tools and resources and information out there to help you either start to implement this in your place of employment or to bring forward to help to make that case. But I also want to recognize that it can be very intimidating, it can be very overwhelming, and it can be the last thing you want to think about when you're trying to take care of a loved one and make arrangements. So we want to fully recognize that this is important work, it's challenging work. I think it's worth the investment. So any final thoughts or remarks before we sign off from you, Cathy, or from you, Allison?
I just wanted to say that we all know that the health system is overtaxed right now. It's overburdened, and there is a place for employers to step up and try to fill some of those gaps. And I know that it's not depending on the size of the organization. They may not be able to implement the type of a program that we have implemented at Ross, but there are other ways, as Allison has indicated, to help support your employees. And I just encourage everyone to investigate those ways of moving forward.
Yeah, and just finally, the point that was made earlier about a very dynamic and changing healthcare system. We're not only managing and navigating a lot of change on the healthcare front, but our volunteer system is also experiencing a whole lot of changes with respect to the nonprofit opportunities that exist to support carers. And given, again, these many changes and the increased responsibility that families are feeling with respect to managing elder care and care of adult children with disabilities, we really have to point to the workplace as really a critical resource in supporting these folks, because the supports available in all other fronts are diminishing. So this is an opportunity for workplaces to step up, to stand up, and to take leadership and responsibility for their employees in order to make a better workplace and a better world more broadly.
Thank you so much. There was a comment in the Q&A about employee sustainability, so a new take on sustainability. So thank you again very much. I'm just going to be trying to share my screen with the final few resources. There we go. So we'll also be putting those in the chat. But if you do have any questions, you can absolutely go here in the tools and curriculum. There's many, many wonderful resources that Allison was talking about, many that she didn't get to. The free online program here specifically designed for caregivers. So this covers, what is being a caregiver. It looks at different information about navigating those complex systems, the importance of self-care, and much more. And if you would like to know more about or would like to give your employee these links, these are great places to go. So a big, big thank you to Cathy and to Allison and to all of you for taking the time to join us here today. We will be following up with the link. So anybody who registered wasn't able to make it live, we will give them the link to the website. But if you do have any questions, feel free to contact us. All that information will be available in the follow-up email. So thank you very much and have a wonderful day.
Thanks, Corinne.
Thank you.
Bye-bye, everyone.